So welcome to Crafting a Growth Mindset, a tool for personal and workplace wellness. My name is Dr. Katie Morrison. I'm a palliative care physician across the street and also the director of the Wellness Initiative for the Department of Medicine. And we have an amazing treat today. So our speaker today is Dr. Marty Schulte. And Marty is an internist who attended the University of Kentucky College of Medicine and did her residency here at CU. She's practiced primary care, internal medicine in federally qualified health centers for almost the last 30 years at sites including Denver Health and the Colorado Coalition for the Homeless. Over the last 5 years, she's worked primarily in the field of burnout and provider engagement in healthcare, both coaching individuals with burnout and questions of personal satisfaction, and working with groups and organizations actively attempting to address burnout. Sorry, my voice is, it's like I'm gonna cry, but I'm not really. She's great, but she has presented to a wide range of healthcare groups about burnout and also about ideas and tools for addressing it. Today, she will present a concept from outside of the healthcare field that connects to personal and professional growth. And I just want to put in a personal plug. So I took a conference on this from Marty a couple years ago, and I feel like it really kind of helped me reframe my kind of constant imposter syndrome into something that was really positive and helped me kind of love learning, kind of embrace that back, and really thrive in my job. So I'd like to introduce Marty Schulte.
Thank you, Katie. And thank you for the personal endorsement. That was a very nice treat. Is the sound okay for everybody before I jump in? Okay, thank you very much. I have that woman thing, which I have nowhere to attach the mic to, so I'm just going to carry it around with me. So thanks to the Department of Medicine Wellness Committee for inviting me, and to my colleague, Dr. Morrison. As Katie referred to, we are seeing, she and I both recently just were at 2 national conferences dealing with provider wellness. And at both of those, we both saw the push toward thinking outside of healthcare for models of ideas that can help us strengthen workplace culture and can help us strengthen workplace leadership. That maybe we haven't got that all figured out in healthcare, and maybe there are some places outside of healthcare where we might invest a little effort in that. And so I'm going to invite you today to journey with me on a concept that's well known in the arena of education. I don't think it's all that well known in healthcare. In a minute, I'll ask how many of you know about it already. But we're going to explore it in some depth today and talk about how we can apply it to both ourselves and to the workplace. So to start with, before we do that, I'm going to ask you to gaze on this beautiful picture. And also, I want you to think about a situation in the last day or 2 that has gone well for you, something that has worked well. It can be big, it can be small, it could be a meeting you facilitated, a nice conversation you had with somebody you mentor. It could have been getting your 2-year-old to get their shoes on. It could be a personal thing, it could be a professional thing, but something big or small, just recently, today or yesterday, that went well, okay? And when you've got it in your head, I want you to stand up. I know you're eating, but I also want you to stand up. When you have it in your head, I want you to stand up. Okay, okay. And now I want you to turn to somebody right by you, and I want you to take a minute for each of you to share your story of what went well. And when you have completed telling your stories to each other, sit back down. Wow, terrific. There was, thank you for engaging with each other, for sharing a little bit, also for starting out this session on a note about something that worked well. How often our brain goes right to what does not work well, right? So we're going to use this story you've just told each other a little bit later on, but it's also a nice way just to share a little bit of life with each other. So before we get too heavy into the concept, I'm going to ask you to watch this video. It's 2 minutes. Pay close attention.
How to juggle 3 balls. Juggling, the noble art of gestures and moves. Here's how you can work your way up from juggling 1 ball to 3. You will need 3 balls to juggle, dexterity, and patience. Step 1. Stand in a comfortable stance with your feet shoulder width apart and your elbows bent at about a 90-degree angle. Step 2. Start by practicing throwing 1 ball back and forth between your hands in a nice gentle arc. You want to keep your elbows in and your throws consistent with the ball arcing at about eye level. Using beanbags when you first begin can be helpful, since they won't roll away when you drop them. Step 3. You'll probably find that your throws go awry a little at the beginning, so keep practicing until you can throw the ball back and forth with your eyes closed. Step 4. Add another ball. With 1 in each hand, throw a ball as before and, before it comes down, throw the other ball underneath it, so it lands in your other hand. Practice catching both balls. As you practice, alternate starting with either hand. Step 5. Put 2 balls in your dominant hand and 1 in the opposite hand. Toss the balls just as before, but add a third throw right before the second ball comes down. Keep practicing until you can make 3 throws and 3 catches. Step 6. Once you're confident catching all 3 balls, add a 4th throw and catch, and a 5th one, and so on. Don't look now, but you're juggling. Did you know jogging while juggling, is becoming a popular sport? In 2007, a joggler finished a Toronto marathon in 2 hours and 50 minutes while juggling 3 balls.
All right, so first thing I need you to do is if you have a water bottle, put the top on and close it. And if you have a cup of a drink that you've been drinking, I want you to finish it up. And then I want you to reach down below your table and pull out these blue bags and take out a set of juggling balls. The good news is there's a set for every person here. So there's a bag here, here's some more. If the group needs it, everybody get a set of juggling balls. Okay, so here's what we're going to do. I'm going to give you 3 minutes. You can move anywhere you want in the room if you need a little more space. I'm going to give you 3 minutes, and we're going to see who can juggle. Okay? So ready? Everybody looks really eager here. I can see it. Okay, ready? I'm going to put on a little mood music because this requires a little mood music, okay? Ready? Go. It's a little dangerous back here.
I like how at the end, yeah. completing a marathon in under 3 hours is the first thing.
An accomplishment, I know.
Yeah.
That's the great part of it. Whoop. How's it going, Jamal? I'm looking for a ringer here, somebody that's a juggler.
Do you know how to juggle?
I'm not very practiced at it. Okay, you have 1 more minute. How's it going? 1 more minute. Look, we need some more music. All right. You can gather up your juggling balls and bring them back because you might need them again. So tell me this. First of all, that was one of the few times I've had to duck balls while I was doing this. So tell me what you were thinking as you were doing this, or perhaps what you were thinking when you realized I was handing out juggling balls. Surprise. What else? No. Never gonna happen. Love that. What else were you thinking? What other thoughts roam through your head? That's what? This is tough, okay? I tried this before and it never worked. I.e., I'm not a juggler. I added that. You didn't say that. Okay. Did anybody say, wow, this is fun. I can't wait to try this? So somebody did, okay? There was a lot of nervous laughter. How many of you spent a lot of time learning to do one? Remember he said, let's do one to start with and get really good at one. How long did you take to doing one before you went to 2 or 3? Somebody said a minute. I saw Kemi doing it for a little while, but one of the things I observe is how quickly everybody goes to 2 or 3 balls. Why did you go so quickly? Peer pressure. Did anybody feel a sense of competition? Yeah, a little bit? Imagine what it's like. Sometimes when I do this, there's like one person in the room who is an experienced and practiced juggler. What do you think that feels like for everybody else? A little louder. You don't want to be the only one doing one ball when everybody else is doing more. So often when there's somebody in the room who really who has experience juggling, people are a little bit like, oh, look at him or look at her, right? So there's a little bit of a discomfort with the person who's more practiced at it, okay? So thank you for sharing the reality of trying something new that you don't have comfort at doing. And we're going to use your comments to help us as we learn about the growth mindset. So he won't let us progress here. All right. Is there somebody technically that can help me advance the slides? Thanks, Kelly. And I'll let you do that. Thank you. That should work for us. So let me start talking about the concept we're going to talk about today. What we're going to talk about is the growth mindset. How many of you are aware of, here we go. Let me put it on big screen here, if we can. Good enough. How many of you are familiar with this concept of mindset? So maybe like 20%. okay? So the mindset comes from a PhD psychologist now at Stanford, Dr. Carol Dweck. And she's been studying in education since the 70s. And when she started her research in the 70s, the primary question she was looking at is, how do children deal with failure? And what she looked at initially was, let me observe how children deal with failure. And so she set up a room for 10-year-olds with puzzles, from very easy puzzles to very hard puzzles. And what she did was she watched them as they made the puzzles, and she listened to them. What did they say as they were making the puzzles? And she was particularly interested in what happened when they hit the hard puzzle, right? And so what she observed is that most of them, when they hit the hard puzzle, did something like wander away, or say, this is stupid, I don't want to do this anymore, or this is boring, or maybe I have a stomach ache and I need to go to the bathroom. So she observed that most of the kids found a way around or away from the discomfort of not knowing how to do it. And when she asked them what they were thinking, they said, these are stupid, they make me look dumb. And but what she noticed was there were a few children who said, this is great, like almost rubbed their hands together and said, this is so cool, it's a challenge. I'm only gonna learn if it's a challenge. She was intrigued by these kids because one, they're kind of an anomaly, and two, she didn't identify with that from her own upbringing. And she said, what is different about these children? And she went on to study lots of students, including matriculating freshmen at Stanford, where she had them write in journals as they were going through their first year and saying, what were they experiencing? And she was particularly interested in their journal as they hit the hard thing. And a similar pattern developed, where when they didn't do so well in a test or they got a bad grade on a paper, she saw similar responses to those 10-year-olds of, maybe they made a mistake admitting me here. The imposter syndrome, right? I'm the person they shouldn't have admitted to Stanford. Or I thought I was good at writing and I didn't do well at this. And again, she found a small group of students who said, I'm gonna have to learn some new study techniques, or I'm gonna have to figure out from people that are doing this how they do it. So there were these few students who were thinking like, wow, I gotta figure out how to do this. This is tough. But for many of them, it became a real personal statement about themselves. And so she really came up with this idea of the fixed and growth mindset. So our mindset is our belief about our abilities and our intelligence. It's not what our abilities and intelligence are, it's what we believe about them. And in a fixed mindset, the general belief is that I was born with these certain skills and talents. That's kind of where I can grow and develop. This is where I stay. And I'm not good at other things. I kind of don't do those. I know I'm not good at it. I mean, I said for 50 years, I'm not creative. That was my mantra. I'm not creative, right? And in a growth mindset, the fundamental belief is that I can get better at nearly anything with effort and work, okay? So nice idea. Why is it such a big deal? Well, our mindset really impacts how we approach things. Are we going to try new things? Are we going to take on a challenge? And more importantly even, how are we going to interpret experiences when they happen? Are we going to say, I tried that and I'm no good at it? Or are we going to say, I tried that, I'm going to need some work to get better at it, right? It's also heavily related to how we think about feedback. I mean, how many of us really love getting feedback? Feedback can be a very challenging thing. There are some who do, and that's wonderful, and I think we're moving more in that direction, but feedback can be a very difficult thing. And so our mindset has a big impact on what we try, how we think about it, and how we think about feedback. So I'm going to give a few more details to give a little more body to the idea of the fixed and the growth. And I'm going to speak mainly in purely fixed and purely growth as I go along. And then we'll talk about the mix that we all actually have. So when we think about a fixed and a growth mindset, I think there's several ways you can think about it. How does someone in a fixed mindset think about success? Well, let's think about those 10-year-olds. When they made the puzzle made them validated that they were a good puzzle maker, right? Validated that I'm capable. So often when we succeed, we go, oh yeah, I am good at this, on to the next thing, right? How often when we succeed do we stop and think, oh, that worked well. What did I learn from this success? What can I take from it? Often it serves as a validation, especially in a fixed mindset. And the worst even is in failure. And in failure in a fixed mindset, often the couldn't make the puzzle becomes a I'm no good at this, what does this say about me? Versus the very discrete puzzle. It becomes a personal statement. Now those are children I'm talking about, but we know that this is true in college students, and we certainly know it's true in adults. How many times have we tried something, it doesn't work, and we make a statement about ourselves that goes well beyond just whatever we were trying. Conversely, with the growth, both success and failure are part of the same thing. They're part of the process because the process is to get better and to grow. And so success we want to look at and say, what did I learn from it? And failure we want to look at it and say, what did I learn from it? In terms of taking risks and challenges, often in a fixed mindset, it can be scary. So if I'm trying something I'm supposed to be good at, it can be a little scary because I got to prove it. And if I'm trying something I'm not supposed to be good at, there's a vulnerability in doing it, right? And in a growth mindset, it's just essential. You have to take risks, you have to try things. Now, I'm not talking about poorly thought out risks. I'm talking about risking and pushing ourselves, right? Effort is probably one of my favorite things to talk about because we live in a culture that loves to idolize the natural talent. You know, the person who seems like they can do it easily. I certainly, you know, as Katie said, I've been practicing for 30 years, so I've been around a long time, but I still can remember medical school. And I can still remember that sort of idolizing the person in the class who seemed like they didn't really have to study to do well in medical school, that somehow the people who look like they can do it more easily must be better at it or smarter at it. So the idea with effort is, yeah, it's okay to try, it's okay to work at it, but if I have to work really, really hard, maybe I just wasn't meant to do it. And that's a very fixed way of thinking about it. Where in the growth mind, so we tend to downplay it, like, yep, I work hard, but, you know, if I have to work too hard, that's not so great. Where, again, in a growth mindset, effort is essential. Effort is essential, and if it's not the effort to accomplish the task, it's the effort to learn new skills to help you accomplish the task in a different way. And lastly, feedback. I mean, if we think of in a fixed mindset that we think of ourselves as these are the things I'm generally good at, these are the things not, getting feedback about what you're supposed to be good at can be a little bit threatening. It can feel like an evaluation or a judgment rather than, in a growth mindset, really a coaching tool, a way to help me get better. And so I think of a brain that's bathed in a fixed set of spinal fluid as always feeling evaluated, either internally evaluated or by others evaluated. And that's an exhausting feeling, right? A brain that is in a growth way, is sitting in a bath of growth, really can learn, can move, can grow. So there's a lot of ways that this is subtly we find and we see. Now, you know, most of us probably have, as you're sitting here, you may be thinking, well, you know, I'm kind of growth about this, and maybe I'm a little fixed about this. So most of us probably don't live exclusively in fixed or exclusively in growth. Probably we have a mix along the way or somewhere in this continuum. Now I'm going to take a moment for air and say, does this resonate? Does this sound familiar? Does this sound like something that you can identify, either personally or maybe even in teams or maybe even in your educational environment that you live in? I generally see some head nods. Does anybody have an example? Thank you.
I work with third-year medical students in primary care clerkship, and I'm shocked by the fixed mindset they present when asked really simple questions. They're just afraid to answer. So, you know, you have an 82-year-old woman, and she has heart failure. What do you say? Nothing. Should you give someone NSAIDs who's just had a stroke? Nothing. They just don't respond, and it's because, for me, my sense is fixed mindset of just, I'm not gonna put myself out there. I'm not gonna.
I'm a student, but I'm still supposed to know the answer, and I don't want to be vulnerable in front of these people. Yeah.
Of things that they all know the answer to, but nobody else
Right.
get their feet wet.
And even worse if they don't know the answer to it, right? Taking the risk of speaking up. How about one more example? Thank you, in the back. Yes. Well, I work with some residents in the internal medicine program, and we often talk about this, and we talk about the challenge of trying to live a growth mindset in an environment that feels pretty fixed, right? And so that's a super challenge. Now, one of the great things is that we can all walk out and start to change that environment, right? And that environment's going to take some time to change, but we all work in these capacities where we can start speaking it. But it's very difficult. And sometimes what they'll say to me is, this is usually interns, because the second and third years no longer say this, but the interns say, this is great in my personal life, but I can't make a mistake. And in my old brain, I want to say, and how's that working? Because, in reality, that approach of we can't make mistakes, we know from, the IOM reports and everything else that the mistakes are happening, right? So that I can't make a mistake isn't fixing it, right? So it is a challenge. I don't have a simple answer for that, except that I think there's ways, and we're going to get to it in a minute, of starting to use language and examples and processing that actually help us do it. Okay? So I hope to give you ideas. All right. So I see head nodding. I see, yep, this sounds familiar. Nice idea. How do I use it? Okay? And I'm very practical, so I want you to take home some, how can I use it? So I think of 3 big areas where we can use it. One is just recognizing our own mindset. Like, that was a little fixed of me there. That gives you a little distance. It gives you a little ability to perspective on yourself or on others. There's even a student who's in a fixed. Is there a way I can speak a different language with them that helps bring them out of the fixed? So that's the first step. And in Dweck's course that she offers to her undergraduates, she actually has them give a name to their fixed mindset. Like, oh, hey, that's Albus. Oh, here's Albus again. It always shows up in these situations, right? So understanding our mindset. The second and third places, which I'm going to give you some tools to, are when we're initiating something new or just something hard, something we've done before, but it's going to be a push for us, and when we're processing experiences, okay? So in initiating, this is where we can start to speak to ourselves in a language that is a growth language. So we heard a fair amount of fixed mindset over here, right? Never going to happen. Thank you, Karen. Tried it before, it didn't work. Some peer pressure, a little sense of competition. I don't want to be the only one that's just doing one ball, right? Very fixed, evaluative, etc. Well, when we initiated that exercise, do you remember what I said to you when we gave out the balls? Well, I said that afterwards. When I first gave it to you, I said, I'm going to give you 3 minutes, and we're going to see who can juggle. So what I did was I put you in a fixed mindset. I sort of ramped up the competition, right? And you went straight to those 3 balls, most of you, right away, right? Because I used language that sounded evaluative and that sounded like, I got to get at this. Now, how many of us really think we're going to be good at juggling in 3 minutes, right? And if you have somebody in the room who is more practiced at juggling, I always ask them how long it took them. It's like a long weekend or it's months. It wasn't 3 minutes. So it's not even realistic to expect that we can juggle in 3 minutes. But I used fixed language we're going to see who can juggle. Well, we could juggle again, and we will. And we can put ourselves into a growth mindset as well. We can use language that says, this is new for me. That already sets a more realistic starting, right? Rather than I better be good at this. We can say, I can learn how to do this. I haven't figured this out yet. That's one of my favorite words. I haven't figured this out yet, but I can keep working at it. I can practice this. This is going to take me a while. Think about this with our learners, starting to use the language that says, you will make progress, not you will know this overnight. What if I try this versus, oh my gosh, what am I going to do? I can try something new. I can ask for help. I can learn from others. So there's a lot of language of a growth mindset that we can internalize and we can use with ourselves, with our teams, with learners. So that's one of the ways to really help ourselves when we're initiating. And then when we've had the experience, and we have experiences all day long, right? We can stop and we can process them. And these are the 4 questions that I think can be really helpful to us when we've had an experience, be it a positive or a negative or anywhere in between. And where does our brain usually go right away? What went wrong, right? So the first question is what worked, okay? So in almost anything we do in any situation, we can find something that worked, even if it's just that I showed up and I tried. But most of the time, we can find much more that worked. Then we say, what might I do differently next time? And this really helps us focus in on just the components that need changing. And it takes us away from that global, this went well or this went badly, to where are the actual pieces that I want to do this? And I'm going to give you a chance to practice this as well. Then the third question is, are there any practices or skills I might want to do to actually get better at this if I want to keep doing it? So I'll use a simple example, juggling. The video, if you remember, said you will need 3 things to juggle. 3 balls, dexterity, and patience. So if you really wanted to get good at juggling, you might cross-train with something that would improve your dexterity. That would be an example of a skill or a practice that I might think I want to do if I want to get better at juggling. And then the last is, what did I learn? And that's when it goes well, and that's when it doesn't go well. What did I learn from this? What am I going to take away? Because we know that consciously thinking about it, rather than just going, oh, went well, on to the next thing, if we consciously think about it, we're more likely to internalize it and use it again, okay? So these are tools that we can use for ourselves, with teams, and I'm going to talk about that at the end. But these are tools we can add to our toolkit. And you're in luck. I'm going to give you a chance to practice a growth mindset. So we're going to juggle again, but this time we're going to do it in a growth mindset, okay? So what might you say to yourself this time around as we juggle again? I can do hard things, and this looks hard, okay? What else? I might need to practice with just one ball for a while. In fact, a long while sometimes. Yeah, okay. What else? I can try it. I can give it a try. I can see what I'm going to learn this time around. So what I'm going to say to you is, I'm going to give you a chance to juggle again and to practice with this and see what you can do with it, okay? So I'm putting you into a growth mindset this time, and I'm going to give you a few minutes to juggle again, okay? So however you want to do it, I'll put on some music, juggle away. Oh, I'm not playing it again. Just take it. Yep, the music went off. We're doing really well time-wise.
Are we? Cool. We started on time.
Can you do it? I see it. Oh, you've been practicing.
Because I've done it with her.
Could you juggle? Are you going to show us?
I'm not
all
very
that's
practiced.
done? Yet.
Yet. I'm not very practiced yet. That's right.
I already lost my third ball. Like I lost it. I don't know where it is.
Because it can't have gone anywhere.
I know.
Oh, that's hers. We'll find it.
I don't know what happened. So there's an opportunity. I was going to say that's okay.
It's not a failure. It's an opportunity. Maybe somebody's juggling 4. How to do what?
It's the web version.
Okay. Well, I mean, it's fine the way it is. How's it going back here?
Oh, really?
Really
Marty, what's your
amazing.
Instagram handle?
I don't have one.
Come on.
I do. I'm sure I do, but I don't know where it is. How are
so
you?
good to see you. It's been so long.
How are you? Look wonderful. It's so
I've
great
been
to see
meaning
you.
to email you like 1,000 times, and I will because I have a couple questions for you that I want to discuss.
Absolutely.
I'm Adrienne Mann. Nice
Adrienne,
to
it's
meet you.
lovely to meet you. I've heard your name.
Oh, good.
I'm Hillary
Hillary. And your last name?
Dunleavy.
Thank you. Yeah, I know your name. Okay, the music has stopped. And so we're gonna pull it in here. And I really hate to tell you this, but I got to take the juggling balls back at the end. Ah, yes. Although occasionally people say, this is kind of meditative. I might get a set myself. So I will tell you, I get no commission, but they're easy to get on Amazon. As is the Mindset book, which I promise you, Carol Dweck does not know who I am, but I push this book all the time. Okay, so tell me, how was it this time around? How was it this time around? More fun, yes. Why do you think it was more fun? What? The pressure was less, right? How did we make thank you. How did we make the pressure less? Right, so we turned it into a learning experience rather than turning it into a performance. You were more patient with yourself, yes, yes. I saw more people juggling just one ball, right? I got to get better at the one before I progress.
Just watch your own progress instead of watching others.
So actually what we know is that people in a growth mindset are more accurate assessors of their own abilities than people in a fixed mindset, because fixed is more about your performance and meeting your expectations. And in a growth, you're more likely to be accurate in self-assessing. So you can watch your own progress and be a little more honest with ourselves. I saw a little bit of people helping each other out, maybe offering some suggestions to each other. Did anybody get any tips from anybody else? So sometimes people will be like, oh, I saw how you were doing that. How'd you do that? So there tends to be more collaboration in this than, and we used the word competition before. Did anybody feel like they tried something that wasn't on the video? Just, hey, what if I do it this way? Anybody do that? Yep. So sometimes people will say, I'm going to turn away from everybody and just focus myself. I'm just going to try my own thing. So we can also be more creative when we're in a growth mindset because we've taken away that self-evaluative piece of it. Okay? So the experience is a different experience. Think about if you are leading a team, you're running rounds, and you put your team into a growth mindset. This is going to be difficult. We're going to do this together. Let's see how we can figure this out together. Versus, who knows the answer to this, right? So we have the ability with our words to create that change, which is very subtle. from the fixed to the growth in the dynamic. So I'm going to give you now a chance so we've talked about initiating and using language with initiation and how that changes the experience. And I hope that your second juggling experience was a changed experience. I see a few smiles, which is nice. Now I'm going to give you a chance to use the growth reflection. Remember that experience I asked you to recall at the beginning of something that worked well in the last day or two? Well, on the second page of the handout, there's a little bit of a reflection piece. And you can do it as I'm talking, or you can just do it later. But I want you to think about this experience that you just had, either today, yesterday, that went well. Think first, what worked? What about this experience worked out? Was it that I was well prepared? Was it that the food was good, the lights were bright? Was it that I gave more time to get the kids ready this morning and that made it work better? What was it that made this work better this time? Okay, so that's the first question. The second question for your what went well is, what might I do differently next time? So there were these pieces that worked, and then these other pieces that I might try differently. Maybe I need to send out the agenda sooner than I did this time. Maybe I need to have more food at it next time. Maybe I need to have more drink at it next time. Whatever. So what are the things I might do differently the next time I do this? Then thirdly, are there any other practices or skills that I maybe want to concentrate on so that I can do this better the next time and the time after and the time after? And then lastly, what did I learn from this experience? I often think when I use this growth reflection that I keep learning the same thing over and over again. Maybe it'll stick one of these times. Often what I've learned is, oh, preparation matters. Practice matters. Preparing in advance. One of the things I will say about this is that being in a growth mindset doesn't mean, oh, I don't have to prepare because I'll just see what I learn. No, what it means is I prepare, I give my best, and then life happens and I learn from it, right? And so even with our best preparation and our best efforts, we're still going to learn from experiences. And each time we do them, we can get a little better. One of the beauties of this is that sometimes we can see that the things we generally see ourselves as good at, we can kind of plateau at because we don't do the assessment to push ourselves in it. This is what I'm good at, I kind of stay here. And this kind of reflection is a way of saying, yeah, these pieces went well, but I could push a little bit more here, or I could learn more about this and grow in this. So we can grow in what we're good at as well as allowing ourselves to grow in those areas that are challenging or don't come as easily for us. Okay, so did you learn anything from your thing that went well in the last day or so? Does anybody want to share what they learned? This is what I find with the residents too. This is why I have to have them in a group of 4, feed them food, and then get them to talk. Okay. Oh, thanks, Karen.
Did a meeting and actually hired a new conference manager. And what went well is that we all knew why we were in the room, what the objective was.
So you had created clarity such that you could move forward. Mm-hmm. Yep. Okay, so I'm going to suggest some ideas for actually, well, let me, before we go to the ideas, let me give you just a little bit of data. So perhaps you don't believe me that this actually works, right? And I am in an academic medical center, by the way, so maybe I should talk a little bit about some data. Well, let's start with data from education, okay? So Carol Dweck has reams of data on using a growth mindset versus a fixed mindset with students in academic situations. And this is just one example of 7th graders, where the first semester they were all taught the same. The second semester, the same kids were divided into 2 groups. One had the same course, the other was taught in a growth way, taught about, our brain, about neuroplasticity and how our brains can learn and how we can get better at things. And they basically taught from a program of using growth language and growth and talking about learning skills and making progress. And this was an academic group that struggled to begin with. So baseline, you can see their GPAs were about 2.5 in math out of 4. But even in that one semester, there was a statistically significant difference in the group that were taught from a growth mindset. And she has loads of data on this. Now, there's not a lot of data in healthcare with the growth mindset, but this is a study that comes from psychiatrists at Harvard. And this is a recent one, just published in 2018, where they looked at 12 to 15-year-olds who opted into this study. They all were given both child depression inventory and an anxiety score. They all scored in the range that a treatment group would, a child depression treatment group would. And they were randomized to one of 2 single interventions. So the control group got a single supportive therapy intervention. It was a video session for half an hour. And it was, it was what we would consider good stuff. They taught them about identifying their feelings, talking to people about their feelings, not doing it alone. So standard supportive therapy. The other group got a growth mindset 30-minute intervention. And that included talking about neuroplasticity, older kids talking about using a growth mindset, the kids enrolled writing letters to younger peers, talking to them in a growth way. And so it was a 30-minute one-time intervention. And at 9 months, the top graph, let me see if I can make the pointer work. The top is the youth-reported scores. The blue line is the mindset group. The red line is the depression group. And all the way out here is 9 months. And statistically significant decrease in the youth-reported depression and also in the youth-reported what they called perceived behavioral control, their own sense of control over their behavior. The bottom one is their parents, whoops, hit the wrong button, their parents' report. And you can actually see that the group that got the growth intervention had a little bit higher baseline score of depression. This is what their parents' report perceived to be. And you can see that the growth mindset group had a sharper decline in their symptoms, and then at 9 months were lower in depression than their control match group. So this group is starting to do a lot of growth mindset-based interventions for adolescents as a therapy, essentially. So that's all the data you get. But let's talk about where does this fit into what we're talking about with provider and physician wellness and all of our healthcare colleagues' wellness. You're probably familiar with this model. I think the Department of Medicine Wellness Committee uses this model. The thought that for professional fulfillment, it comes from Stanford and the Mayo Clinic. And the idea that our professional fulfillment and our workplace joy comes from 3 big areas. How well does the workplace work? The efficiency of practice. What's the culture like? The workplace culture that we're in, or the educational culture? And then what do we personally bring to the table? So there's three big components. And I think of the growth mindset as having a lot of importance in obviously personal resilience, but also in the workplace culture. So let me touch just very briefly on personal resilience, because as important as I think this is, I think that burnout and building healthy workplaces is organizational responsibility. And so I'll get to that quickly. This is a wonderful book that I use quite a bit. It's on your reference list, Resilience. It's by 2 psychiatrists who talk about 10 traits or key traits to building our resilience. And I pulled out the 4 of them that I think really are nicely addressed by thinking and working in a growth mindset. And those are developing a positive attitude, having more cognitive flexibility. That's what we're talking about with initiating and processing in a growth way. Facing our fears, from as small as juggling to much bigger fears, and then really developing active coping skills. So this is potentially a tool, one very good tool, to help us in those components of personal resilience. And in the culture of wellness, where does the growth mindset come into the workplace? And this I see as endless opportunity, right? I mean, let's think about it. We have teams, we lead, we mentor, we advise, we support, we have partners, we have friends, we have children. We do it all day long, right? We can, as a team, begin to use the language of a growth mindset. We share that common language. We can start to speak it. We can model it. We can be the models of it. And think about the emotional safety that this potentially then can create that not only allows people to take risks like answering simple questions to taking big risks like dealing with errors. So if we're dealing with them in this is real, I don't mean to minimize it, this is real, but if we're going to move forward, blaming doesn't help us not repeat it. Learning from it does help us not repeat it. How do we face challenges? As I said, being a role model, and certainly as I tried to demonstrate with our juggling, we are more collaborative in a growth mindset than competitive, and we're more creative in a growth mindset. And that's in problem solving and a range of other things as well. So how do you start using it? If you're going to use it, you're going to have to develop the muscle. Some of you may already have the muscle. Kelly was the one who said this could be fun, so she might already have the growth mindset muscle. But if you don't have it, or if it's a small muscle, you might want to work on building it into a bigger muscle. And how do I do that? Well, I told you, the first thing is start by noticing your own mindset, then starting to really use the language. Then use the language when you're going to initiate something new, when you're going to try something different, when you're with your team, when you're leading. And then I think most importantly, actively practice the growth reflection. And I think of this in a very practical way. All of us commute home, hopefully at the end of the day. You're in the car, the train, the bus, whatever, your bike, you can think of it globally. How did my day go? What worked today? What would I do differently? Or I can very specifically think of one experience. Just pick one thing from the day, like we just did at the beginning of this. Let me think about this particular thing I did. I'm going to think about it in a growth reflective way. And if you're a person that does journaling or a narrative, this is a great template to do some journaling with. I think I each day will reflect on a particular experience. It's a nice tool to use around the dinner table. What was something that went well today? What was something that was hard today? What worked about it? What would you try differently next time? So there's endless opportunity to begin to use it in a practical way in both our personal experiences as well as our professional experiences. Anybody have other ideas to use it or where they already use it? Yeah. Yep. The rose and thorn is a nice way of doing it. There's a story from the woman who started Spanx, if any of us know Spanx, and she's a billionaire now. But she grew up in a household where every day her father would ask her and her sister at the dinner table, what did you fail at today? And the idea was that she eventually learned that the only thing that would make her father upset is if she didn't try, if she didn't risk. Because she was rewarded for trying stuff that didn't work. And too often, I certainly did growing up, we get a message pretty quickly of you're good at this or it's not so good to fail. And then we incorporate that and we start to create that image. So giving ourselves the opportunity to think about it from failure as a wonderful opportunity. Okay? So here's some ideas for developing your growth mindset, muscle. And I want to wrap up by tying this together. I don't know how many of you have seen this yet. This is from the National Academy of Medicine. It came out about 3 weeks ago. It's about 300 and something pages long. And it's their summary book on burnout, clinical burnout after their 18-month initiative. And on about page, 280 something, you get to the conclusions and recommendations. And there are 6 general categories of areas for action. And I would advocate that the growth mindset and approaching things in a growth way is one tool to begin to think about the first 2 of those, which are creating a positive work environment and creating positive learning environments. So I'm going to conclude there and open the floor to questions or comments. So some common ones are yet or practice. So one of my daughters is a kindergarten teacher, and when she talks about her kids, she says, this child is very practiced at this, and this child is not very practiced at this. And often when I have somebody in the audience who does juggle pretty well, I'll say, look how this, let me ask this person who's very practiced at juggling, how long it took you to do this, right? So starting to use the language of this is new for me or this is going to take work. There's several books you can get on it. There's some on my reference list as well. I'm happy to refer you to them. But the language of what did you learn from this? I'm going to try this and see what I learned from it. Or what was this experience like for you? What did you take away from it? Katie?
We use this almost all the time. I use it almost all the time with our fellows because I think they come in thinking they're really good at, palliative care, and then I think the first couple months they feel rushed. And so we use this after every family meeting. What went well? What was the difference you get stuff? And I think it just, I even do that with myself. It feels like a life threat to me. Kind of read me for
Mm-hmm. Thank you. Anybody else have examples of using it or question? Yes.
I just have a question. I think I've read some articles about how physician burnout is really not the appropriate term to be using. What do you think about that? And I think the term moral injury is kind of vague.
Right.
Maybe not everyone.
Yeah. So the question is burnout the right word? It's the fault of the individual, right? It implies it's the individual's problem and that they need to fix it. So here's the challenge. If you talk about professional fulfillment and engagement, you don't get anybody's attention at the top of the food chain, okay? So it's not, that's what we're all seeking, but that sounds fluffy and luxurious, right? And so burnout is a term that can generate a buy-in, even if it comes laden with some other stuff. And so I was working with a big organization in town. There was a group of physicians working on provider engagement. They'd been working on it for a year, and then one of them did a burnout study for the organization. And when the C-suite saw the results of the burnout study, that's when they jumped into action. Okay, so that's the reality of it. Now, there's not an exact right term that captures the pain and the emotional exhaustion and all the components that says this is an organizational problem, not an individual problem, which is what it is, right? I don't have any trouble with the term moral injury. Moral injury is, made pretty popular by Z-Dog. And his viral video on moral injury. If you haven't seen it, it's quite popular. But I don't think it captures everything about our experience in the healthcare environment and all of the systems and organizational issues. So I think moral injury is a very real part of what we all experience, but it's not the whole part of it. So I really shy away from what's the right word and just say people are struggling and there's a lot of big organizational problems, issues that are components of it that need to be addressed. I definitely think the pendulum is swinging away from blaming the individual, and that's a very good thing. I don't think we yet have a good handle on what are the best things organizations can do to address it, but the pendulum is definitely swinging away from it's your problem. Do something about your burnout. Thank you. I think that is it. Thank you very much for your time. And no sneaking out those juggling balls.
Hi all, if you did not sign in, could you please just sign your name? It helps us know how many people attended.